Hi everyone, I'm Lynsey Henry and I'm back for another live event with Stigma-Free Society. Now, I'm a school counselor in Surrey schools. I work as a kindergarten to grade 7 students, and I also work as a registered clinical counselor. Just a reminder, please take a moment to review our video disclaimer inside the video description. We just want to look out for you and your safety and make sure you're getting support and counseling support from our health professionals if you need it. So we're doing these live events for you. So just a reminder, if you have any comments or questions for me, please leave them in the comments box and I will try to answer them to the best of my ability. And our Stigma-Free Toolkit, it is available at www.stigmafreetoolkit.com. And there are lots of great resources for youth, for parents, and for educators and school counselors like myself for you to look through and help you during this tough time of COVID-19. So this week I wanted to talk about trauma. And last week, our wonderful Dr. Dana also spoke about post-traumatic stress disorder, which is related to trauma. So this will be a bit more of a general trauma talk and tailored to youth. So you might wonder, well, why is this important to talk about right now? Well, there's lots going on in the world right now. And last week we had Blackout Tuesday, lots of talk of racism around intergenerational trauma, and even just about the coronavirus and how Chinese people, where it came from in China, lots of misinformation and things going around. So that's racism there as well. And also right now, it is in National Indigenous History Month. So lots of teachers in their class are talking about the intergenerational trauma that has happened for Indigenous students in Canada, what happened in the residential schools. So I was lucky enough yesterday, I happened to walk into a grade 5-6 teacher's class, and he was speaking about intergenerational trauma to his students. And he was reading this wonderful book called The Secret Path, and it's about the residential schools in Canada and a 12-year-old boy, Charlie, whose name is actually Chani, and how he ran away, tried to get away 500 kilometers away from this residential school. And he was explaining to the students the impacts of intergenerational trauma and kind of what that meant and how old Charlie would have been today. And I just thought it was really powerful that he was sharing those hard discussions with his students and opening their eyes up to those traumatic things that happen in the world issues. So I thought that was wonderful. For myself, as a school counselor, I come across a lot of students that I feel like have experienced trauma. These are often students I find that will like trash a room. So when I say trash a room, I mean sometimes things will get thrown around, like pencil cases, desks tipped over, and things like that, because the student is experiencing a traumatic reaction and a trigger. So it's important to remember that's not the student's fault. It's not the youth's fault. That's something that's going on in their brain with the fight, flight, or freeze in our brain. So Dana explained it really well last week. To me, when I think about a reaction in the fight, flight, or freeze, I think to an example of a bear. Like we see a bear in the forest. What are we going to do? What's the first thing that we're going to do? So we're either going to fight off that bear. Whoa, that would be very difficult and scary. Or we're going to run from the bear. That's the flight response. Or we're going to freeze and hope that the bear somehow goes away. So that's some things that go on when we're feeling that traumatic reaction, that fight, flight, or freeze response. So I've been to a lot of workshops as a school counselor. I went to one last year in February around trauma-informed practice, and I also went to another one as a school counselor. So I wanted to share some of the different images that they shared with me in those workshops because I thought they were really powerful and there was lots of really great tips there. So one of the images they shared with me, I will post it in the comment section after, is the do's and don'ts of a trauma-informed and compassionate classroom. So for teachers, this was really interesting. The first tip they talked about is creating a safe place. So we want our youth to feel physical safety and emotional safety. So for myself, as a kindergarten and grade 1 teacher, I had a calm down corner set up in my classroom where students could go, and it had pillows and different fidget tools they could use, a glitter bottle, and just a place for them to take some deep breaths and take control of their feelings. Another tip they shared was establishing predictability. So as a teacher, you can do that by having a visual schedule, having pictures on it for younger students, and really supporting students through transitions. So that means like switching from math to writing and front loading them and telling them, hey, this is what's going to happen next, and establishing that predictability. That promotes security and safety for the student. Offering them choices. So using a power with rather than power over strategy. So instead of saying to the student, you have to show your learning this particular way, maybe presenting a couple options. Maybe you can show it in a video of yourself doing a presentation instead of talking in front of the whole class. You're still getting the same lesson accomplished and the same goals, but in two different ways and with that power with strategy. Another one is staying regulated. So helping everyone in the classroom stay in a resiliency zone, in that calm zone. And you can do that, like I mentioned, through the self-regulation toolboxes, having stress balls available for students, just different flexibility of seating, or even those exercise bands and other fidget tools like bracelets. And it helps students so they're not bumped out of the zone. So there are two different zones of hyper-arousal, and that's when our body is feeling angry, nervous, or panicky, when our heart's beating fast. Or there's also hypo-arousal, and that's when the body might be feeling more depressed, more numb, or fatigued. So this also kind of connects with another program that a lot of schools use called the Zones of Regulation program. And that separates feelings into 4 different color zones. So I'll just briefly explain it to you. The green zone is when a student's feeling calm and ready to learn. Red zone's when they're feeling more angry or out of control. Yellow zones when they're feeling more anxious or silly. And blue zones when they're feeling that slow kind of feeling, depressed or sick or tired. And so that ties in well there with teaching self-regulation. The big don't that they shared in this poster was don't punish kids if the behavior is related to some sort of trauma symptom or trauma reaction, if you suspect that. Just teaching them those different coping skills. Another image that they shared is this, and it says, what can I do? Trauma-informed support for children. So some of these tips overlap a little bit, but they're also good ones that you can use as a parent at home to support your child if you feel like they've had a traumatic experience, and what you can do to support a friend perhaps. So once again, it's that creating safety, allowing breaks. If there is an argument in the household or something, allowing your child to just take a moment, maybe go outside for a breather, or just go to the washroom and take some deep breaths. If you're in a classroom, that's going to that calm down corner once again, and allowing the child some space. The next step is regulating the nervous system. So people that have experienced trauma are quick to get to that hyper-arousal or hypo-arousal state. So by helping them find different coping strategies that work well for them, it can really help calm them in those moments of hyper or hypo-arousal. So some suggestions might be, if it's anger, maybe something cold, an ice pack or ice in their hand to pass back and forth. If it's anxiety, maybe it's getting them something to fidget with, like a bracelet or a ring, or a stress ball, for example. And not all of those things are going to work for every student, so it's just finding what works for them. The next one is building a connected relationship. So really having that warm, empathetic relationship as a parent, as a teacher, as a role model, or a friend. And that's the number one way to regulate our nervous system, is to have that calm person that we care about around us in those moments. And that creates oxytocin, and it goes to the brain and helps us calm down, and the nervous system calm down after stressful situations. The next tip is to support the development of a coherent narrative. So that's that predictability and that routine. And that allows to create logical connections and understand their story and their sequence of learning. That's a consistent adult role model, really, and it could be anybody. That's really a big resiliency factor for a lot of kids, is having that one role model. Practicing power with strategies, like I said above, making sure we have empathy and regard for the child or youth's feelings, because their trauma could easily be triggered if we're not showing that empathetic and warm approach. Developing those social, emotional, and resiliency skills, because that trauma robs a child from developing some of these resiliency skills. They're often in survival mode. So that for me, that's maybe the students that might be hiding under a desk. They're in that kind of freeze mode and that numb kind of hypoarousal feeling. They don't have those calm down strategies necessarily modeled to them at home if it was the home that caused the traumatic reaction. So you have to help them learn it at school, or that positive role model, help them learn some coping skills. The last tip is to foster post-traumatic growth, and you can do that by encouraging problem solving, planning, and to maintain focus despite discomfort. So put them in uncomfortable situations here and there, these youth. So if they're really scared of speaking up in social situations, take baby steps. And it's okay to be a little bit uncomfortable sometimes. We don't have to speak up for our children. We want to encourage them to take risks. And another aspect is just teaching self-control and encouraging them to seek support when they need it. So I thought those were all some really great tips. What I do as a school counselor, you might wonder. So I do a couple different artistic activities with students to help them process trauma. And one of them is this therapeutic dream catcher. So it takes a few different steps. But what I get the student to do is write all the negative words or negative things going on in their life inside the middle to be covered up in this web of the dream catcher. And then on the outside, I get them to write all the positive things in their life that help them feel good in moments of distress. And then we add some glitter and do some fun things to weave the string through. So I find it's really fun for them to express their feelings in that way. Another thing that I do with my students that I'm going to do with you later is this safe place tree. And just having something to visualize to go back to a peaceful place when we're feeling those moments of distress. And it also has a really good meditation at the bottom, some breathing strategies. Another resource I use with my students is this trauma-focused cognitive behavioral therapy workbook. And I found this for free on Pinterest. And I like it because I like to try and focus on CBT in my practice. So it encompasses and incorporates that trauma component. So some different things inside. Get the student to really think through and learn about upsetting and confusing events, and not be afraid to ask their caregiver questions about those events and having those open conversations. Teaching relaxation strategies, teaching belly breathing strategies, about a safe place, where we experience our feelings in our bodies, and just those different feeling faces and recognizing those. Another thing I've used a few times are these trauma reaction cards. And they're good for children and adolescents. And it's good to just get a sense of different areas that the student is struggling with in their traumatic symptoms. So it goes through different body reactions, behavior reactions, feeling reactions, and brain and thinking reactions. So I'll go through a couple of the examples with you so you get a sense of some different trauma symptoms in youth. So for body reactions, it says jumpy or easily startled. So that might be that hyperarousal system, that they're feeling quite jumpy and startled by little things. And little things can trigger trauma. It could be even a tone of voice. So just really watching for those things as an educator or as that positive adult role model. Avoiding people, places, things, or sensations related to the trauma. So that's a behavior reaction. Another one for feeling reactions is not enjoying the things that you used to. So that might be that hypoarousal reaction and just distancing and feeling numb. And that's a feeling reaction someone might experience. Brain and thinking reaction, difficulty concentrating or focusing. So in class or at home on activities, they might be experiencing something called flashbacks related to PTSD, thinking through what happened in the past, and that's really distracting them. So those are some different symptoms, and it comes with a little checklist for me as a counselor so that I can highlight those symptoms and discuss it with the child that those might be their triggers and different ways to work on those symptoms and help them regulate. Another way that I've been taught is the low arousal training for distress management. So when responding to a situation where a student might be feeling more aggressive in the classroom or whatnot, just modeling and appearing calm with the student, maintaining personal space from the student, eye contact when somebody is in a distressing situation. It should be regular but also intermittent, and that means not staring directly at them. Because if you stare directly at somebody, sometimes that can be perceived as being quite aggressive and threatening. Avoiding touch. So as a counselor, I'm not allowed to touch students. We need to think of other ways to distract and redirect them if they're feeling very distressed from a situation. Also reducing the noise in the classroom, maybe even the dim lighting could help. Listening to what the student has to say in that moment of distress, and communicating with them should be very direct language, so that they can process that. So it would be, why don't we go outside? I can see you're feeling a bit angry. Or even less than that, let's go over here. Let's try this to help manage your feelings. Distracting them with something they really like, whether that be Pokemon cards or something else you know that they love, art, and removing an audience from the room. So if the class is in the room, removing the classmates, removing other adults until this person, youth, is feeling more calm. And if they're getting more aggressive, then you can invite another person in to support you as a professional. And just debriefing those situations with your colleagues, with the people you work with, other educators, other parents, debriefing when there is an escalating situation like that and processing those emotions can be really helpful. The last thing I wanted to mention with you before questions was the ACE study, and that's Adverse Childhood Experiences. Now, this study was done in 1998 in California by someone named Folletti and Anda, I believe it's pronounced. They talked about adverse childhood experiences and did a questionnaire of 10 different questions. So they measured 3 different areas of distress, and that was abuse, neglect, household dysfunction, and they wanted to see if that increased the risk of the child having negative health outcomes. So here's what they found. They found that 2/3, or 60% of the population, had at least one ACE score. So they answered yes to one of those 10 questions. 1/4 of the population they measured, or 27%, had at least 3 or more of those questions marked as yes. So you might think to yourself, well, what are these 10 questions, Lynsey? So the 10 questions were about parental separation or divorce, parental addiction, household mental illness, domestic violence, physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, or parental incarceration. So all those 10 questions were related to those 10 items. And what they found for negative health and behavior outcomes by having a high ACE score was that maybe the person had a lot of physical inactivity. Maybe they were a smoker, maybe drug use, alcoholism, absenteeism at work, obesity, diabetes, depression, suicide attempts, heart disease, and stroke. So overall, the study revealed 3 things. First, that children are exposed to a lot of trauma. So that's why it's important for schools and educators to be on board with these trauma-informed practices. Second, trauma impacts our social health and our physical health and our mental health. Thirdly, the more trauma a child experiences, the greater impact it can have on some of these health and behavior outcomes. So overall, that's why it's so important to teach coping skills, things like the growth mindset, which is all about positivity and saying we can do things, and also social emotional learning, like the zones of regulations and things like that. So I wanted to take some time now for questions, and then I was hoping to do a quick activity with you on paper like I usually do in creating that safe place tree, or that peaceful place tree. So I'm going to scroll down here and see if we have any questions. Can these strategies be applied to adults in dealing with their own trauma? I believe some of them can overlap because, well, there might be some different coping strategies that a youth might use over an adult. For example, fidget tools obviously are going to be more discreet for an adult than a child. A child might have a basket of calm down tools in their classroom or at home, whereas an adult might use something more discreet like a bracelet or a ring or lavender oil or scents that help them feel good, lotions and perfumes. So they're similar in that they're self-soothing strategies, but might be a bit more discreet for adults. So thank you for that question. For educators and counselors, when students are shown these symptoms, When do you reach out to the parents? So for me as a school counselor, I have confidentiality rules I have to go over at the beginning of sessions with a child. So if there's any sense of safety or danger, I have to report to the ministry. So for example, if there was any disclosures of abuse, whether that be emotional abuse, physical abuse, sexual abuse, I am responsible as a citizen and a counselor to report that to the ministry. Also, I tell the student that at the beginning through my confidentiality rules. If you're at risk to yourself, to others, or if somebody is at risk of hurting you, I do have to tell those things. So I lay that out there right away so that the student is aware. I will have to tell if there is anything to do with trauma or safety issues in the home. So thank you for that question. Can you explain a little bit more about CBT and why it's good for dealing with trauma? Yes, of course. So cognitive behavioral therapy really focuses on a triangle of our thoughts, feelings, behaviors, and they're also integrating our physical reactions into that equation. So by focusing on our thoughts, we can start to see different patterns in our thoughts. There might be some unhelpful thinking styles like catastrophizing, which is building things to be worse and worse and worse than they are. What if this happens? Then what if this happens? Then what if this happens? So that's one unhelpful thinking strategy you might notice in focusing on your thought patterns. And just by looking at your thought patterns, you can find what your triggers are. And incorporating those trauma components and focusing on the body is where the kind of TF-CBT style comes in. I'm not particularly too familiar with TF-CBT. I'd like to become more familiar. I'm more familiar with CBT, but that's my understanding. It's good to deal with trauma because you can focus on the thoughts. So I hope you find that helpful. What if trauma that a student has experienced happened at school, such as traumatic bullying experience? Wow, that is a particularly troubling situation. So that would probably involve the team of the principal, vice principal, school counselor, and discussions with the parents in making that environment of the school a more safe place for the child. So there's different adaptations or things that could be done to help support that student. Maybe that might mean moving the child to a different class, might be having to resort to move the child to a different school if the trauma is that bad and the student is having that severe of reactions. Other strategies, just getting them in a room and just allowing the children to talk it out together in a safe place with adults there to help support them. So that's what I would say about trauma at school. Thank you for speaking about this important topic. You're welcome. I do believe that trauma is a very important topic right now with all that's going on in the world. So thank you for recognizing that. What are some good alternatives to punishing students in the classroom or at school if their behavior is difficult? So punishing, I would say like reward systems, reward-based systems. So allowing them to have perhaps like a sticker chart or maybe a classroom store where their good behavior is rewarded instead of punishing their negative behavior. So hopefully that makes sense. It's more of a reward-based system, positive reinforcement versus negative punishment. And a behaviorist or a district behavior specialist can even come into your school and track some of those behaviors for students with really difficult behavior and help set up a good reward system that is not so much punishing, but more so rewarding and positives. So thank you for that question. All right, touch is super personal to each individual. I don't like being touched if I'm feeling triggered and vulnerable. Yes, I 100% agree with that. So in distressing situations, we do have to be really careful, especially with people that may have experienced trauma, in not touching, avoiding touch, especially when they're feeling more aggressive, right? So just being sensitive to that. So thank you for pointing that out, Fantasia. It sounds like some of the things you mentioned might be good tools working with those that have special needs. Would you agree? Yes, absolutely. And in Surrey schools, we have students in BASIS programs in high school, and they use a lot of the same sort of strategies in distracting and redirecting students and just appearing calm not using any touch. It is really good for special needs students as well. So thank you for pointing that out. All right, so that's all the questions I see right now. If another one comes up, please let me know and I'll try and answer it at the end. Otherwise, if you have a pencil and paper handy, I want to do the tree activity with you. So I want you to draw your own safe place tree. So take a moment to think about what that might look like. Is that an autumn tree with red, orange, and yellow leaves? Is that tree a cherry blossom tree? Is it a winter tree with snow on it? Maybe it's a spring tree with bright green leaves. Maybe you're using your imagination and it's a rainbow colored tree. Whatever works best for you. And it's something that you can visualize to keep yourself grounded when you're having a difficult time or difficult feelings. So I'm going to sketch out my tree, and I hope you have your pen so you can sketch out yours. And then I'm going to read the meditation to you that I have on the Safe Place Tree worksheet, because I think it's really great and a good one to do for youth or children before bed to really get them nice and calm and getting them to think about those peaceful and happy thoughts before bedtime and calming the body down with that slow breathing. So for myself, when I think of a tree that would calm me down, it's a cherry blossom tree. Because in my home, there's lots in my complex all around in the springtime. And just visualizing those pink flower petals on the tree really kind of make me feel nice and calm and centered and also grounded to the present moment. So I'm sketching out my tree here. And you might even color yours afterwards. So I usually color them with my students as well. I have all my little blossoms. And you can blend different colors or use watercolor paints for this as well, and it turns out really nice. Okay, so here is my very brief sketch of my cherry blossom tree. And I'm going to take a moment to read that meditation to you. So once again, here's the tree that I usually print out for the students. And here's the meditation. I can take a deep breath in through my nose and slowly breathe out my mouth to calm down my body. I can imagine a tall, strong tree while I take deep breaths. This can help my body feel safe, peaceful, and calm on the inside, just like the tree. I can imagine I am strong and connected to the ground, just like a tree. I can take deep breaths and relax by imagining this whenever I need to feel calm and safe. So I'll share that resource with you afterwards as well in the comments link. Another quick thing I wanted to mention, if there's no more questions, is just another article I came across from Carolyn Turner from Lavender Counseling. And she was talking about returning back to work for both educators and students right now, and how this might kind of have a traumatic response for us in returning to work, because the school is so fundamentally changed right now with smaller class sizes, teachers doing lessons online, and doing a few lessons with a small class size. So in her article, she also talked about that hyperarousal system, being on alert as an educator, might have higher expectations for ourselves, really strict lesson plans and things. We're putting a lot of pressure on our hyperarousal system. She also talked about the hypo-arousal system and how educators or people that work in schools right now might be feeling numb or disconnected. They might be experiencing some memory loss, even leaving their keys different places by accident. Or they might just feel like they're going through the motions to get through June. So in order to avoid this traumatic response in returning to school, she suggested that we reconnect and re-engage with our body and how our body might be feeling those trauma symptoms. Just noticing the sensations in our body. Maybe we might have a tight chest. Maybe our throat feels dry or tight. Maybe we have a heaviness in our shoulders. And just allowing ourselves permission to feel our emotions, notice our thoughts, and just notice our relationships and what's been helpful during COVID-19. And to go as an educator into the classroom, pause, connect with the kids, listen to the birds outside, the sun shining, and just be there and present in the moment and helping those children smile that do arrive in our classrooms during this tough time. So I really appreciated her tips as well, and I will link the full article that Carolyn Turner wrote from Lavender Counseling in the comments box. So I think that's about all that we have time for today. So thank you so much for listening in today, and take care.